And so we wanted to, of course, I have a fire truck that was passing. But of course, so with each meeting, we want to keep grounding. So to keep the work plans that we develop alive, and not just something that you do and sit on a shelf. We do want to just kind of highlight where we are with the things that we're going to discuss in each meeting and how they relate back to the work plan. So today, our first goal is to advocate for the implementation of health and all policies, specifically CR 127 2020. And so today, that's why we're welcoming and learning more from Dr. Levy here today. But then also not just so that would and so the Black Mama study, we also have a commitment, and it's not highlighted on this particular slide, but we also have a commitment in the next slide, actually, objective 2.22, to learn from community partners and receive monthly presentations. So our our agenda topics, they are strategic, and we want to just continue to share that at the beginning of or during each meeting. And with that, we'd like to welcome Dr. Levy, our Prince George's County Health Officer, Chair of the Prince George's Healthcare Action Coalition, and the CEO and Secretary of the Board of Health, to share with us changes in the Board of Health structure, engaging. And then we asked to learn a little bit more about how we, as the Health Equity Work Group, could engage in Board of Health, what the Board of Health is doing, their communication paths, and learn a little bit more about Dr. Levy's vision for the direction on implementation of health and all policies. So with that, thank you, Dr. Levy, and welcome.
Good afternoon, everybody, and thank you first for all the work that you're doing on this committee. It's really critically important to the work that we do, and I appreciate that you're all volunteering to do this. So that's even, that's really shows a commitment, and the fact that there's 22 people on the call is tremendous. And I want to thank our co-chairs, and I want to thank Kim for kind of help moving this forward. And I also want to acknowledge Anya on the call, who is the council's liaison and advisor to the Board of Health. And we've been working more closely together to try to create agendas and move things forward. So let me kind of give you the broader understanding of this. So when actually Anya looked at the regulations for the Board of Health, it actually created a pivot point for the Department of Health in how it relates to the council through the Board of Health. So the council sits as the Board of Health, sort of plays a dual roles, and it's the same people, but they're acting as the Board of Health. In the regulations for the Board of Health, the health officer is both the CEO and secretary of the Board of Health. And if you think about how a normal Board of Health works, it usually your CEO is sort of driving the business and then reports up to the board, and the board helps to drive the direction and the vision, but usually that's also brought by the CEO to help inform and educate the board, and then the board brings their opinions and questions and concerns to the CEO and to the whole organization. So that's the structure that it really is supposed to be by law. So as we move forward, we're trying to evolve to that, but really more importantly, as we are we're meeting with the board now. We're meeting with the Board of Health and i.e. the council, every month, and we're trying to educate them, get their feedback on what they hear from their constituents, try to make sure that we're really on the same team, right? We're all on the same team. We want to improve the health and well-being of the county residents. And our vision is, as the health department, is all Prince Georgians will be their healthiest at every age and every stage. And that's our goal. And that's really the council's goal and the Board of Health's goal as well, because the council has other goals, but the Board of Health and the health department, that's really our vision for our vision for the future. So we've been creating essentially every month we are meeting with them, and we're using that opportunity to both get the Board of Health up to speed with what's happening in the health department, but also to pick a topic to go much deeper on. So last month we presented to them on the community health assessment, and actually some of the work that you all do, we kind of gave a high level overview of what you're all doing in this committee, as well as the other committees for the Healthcare Action Coalition. We presented lots of data from the 2022 report and then answered some of their questions, and giving them a sort of a foreshadow of the CHIP that's coming up in the not too distant future. This coming month, we're going to talk a little bit more in depth about behavioral health. And so that brings us to the pathways of communication and how we engage and work together. Thank you, Kim. The CHIP is the Community Health Improvement Plan. I should know better, because the acronym soup that I jumped into, I'm still working my way through it. So I shouldn't I should do as I learned to spell those out. So thank you. So the question really is, how do we engage the Board of Health? And I think so that and especially around health and all policies. Health and all policies was supported by the Board of Health. The council put out legislation and supporting it, and the Department of Health supports the concept of health and all policies. Obviously, we feel very passionate about it in that it's one of the committees in the Healthcare Action Coalition. So the county feels it's important. We feel it's important, and the topic that you've chosen is important. And the question is, what do we do to move this forward, and how do we work together on all of this? So the way I look at this is, right now the Department of Health we are organizing ourselves. We're trying to streamline our processes internally, and we're actually about to launch into a strategic planning process. That strategic planning process will include community members, and that strategic planning process will include a section on health and all policies. And I would like to work with this committee on figuring out what that looks like and how we put it into the strategic planning process. Moving this all forward is going to take person power, and is gonna drive us, and we need someone dedicated to championing this to move it forward. And I've spoken with several different health departments around the region, and Fairfax has a pretty good program. They've been working on it for like 10 years, and also I think St. Mary's has a program as well. Montgomery's looking for it. And it really is about infusing like health and putting health in the forefront of everything we think about and do as a county government and as a county. So I'd like to work with you to figure out how best to approach that in the strategic planning process, which is going to take us probably for the next, as soon as we start the process, it'll be somewhere between 6 months and a year that we're going to get this together. And that'll be our 5 to 7 year strategy. So as we put it in there, then we can start living it, and we can start hiring someone to put that in. In the immediate time frame, what the Department of Health is going to be engaging on is the strategic planning process, as well as the public health accreditation board application. And those two are, and a lot of that is sort of tangential to health and all policies. So I think we're headed in a really positive direction. I like the work that you all have been doing, and I want to make sure that we align that and infuse that into the strategic plan for the Department of Health as we move forward. Now, how do we communicate with the Board of Health on this? I think we should, it's a topic that's passionate, that they feel passionate about as well. And I think we need to, I think we need to start the high level conversations about what the timing is, what it looks like, what's the planning, what the plan of it is, and then how do we ultimately get it really going so that there's a dedicated person and they are championing this. I said it a second time so I could say it right. Championing this forward and moving it towards health and all policies. So I don't know so I hope I kind of addressed that component of it. The work that you're doing matters, and and all the development of of what you're putting together is going to be rolled into kind of all the things that we are doing to move that policy forward as we create the strategic planning process. So I'll stop there for a minute. I want to see if people have questions.
Thank you for sharing. Oh, go ahead.
No, I would just say, so keep going with what keep going and continue the process. And we'll start to see how it structures into what we're doing for the strategic planning process. So it actually, you want to see your work make a difference, right? And if we put it into what we're doing, it'll be what my plan is that the strategic plan is what we live for the next 7 years. That's the point of it, right? So I want it to be part of that. Sorry. So you were going to say something, Christine.
No, I was thanking you for sharing, just giving us an overview of where things are with the Board of Health, with kind of the restructuring and your thought process on the next steps. And I did hear that you mentioned that there was support from the health department and the Board of Health or for HIAP. I do know that when CR 127 2020, the Health and All Policies resolution was implemented, that was in a previous county council. And so the champion has since left. And I do hear that you and Anya have had to provide education. What sort of understanding so there's support, how um do they need any other assistance from the coalition or community members for actual action? That's one of my questions.
Yeah, and I would say at the very moment, probably not at the moment, but that doesn't mean that there won't be lots of opportunities in the near future for testimony and support from the community and from the around it. And in fact, once we're ready to kind of rock and roll on this, we could bring the report to the council, and maybe one of you can present it. I mean, it doesn't have to be me or Kim, but we could do that as well on behalf of the committee. I'm not wedded to that. What we started to do is sort of spread it out so that they don't always hear from me. I don't want them to do that. I want them to hear from our experts and our leaders and this coalition is also part of our leadership, right? The whole organization is the voice in part of the community, and that's really what they also hear too, because they hear from their constituents the needs of the community and how we look at this. The challenge, I think, with the health and all policies is that there has to be enough buy-in from the the health department is in some ways an easy one, right? The hard part is going to be public safety and and parks and planning and uh, the Office of Management and Budget. And I think we're not there yet to get them on board. But we're building towards that. We're building those relationships and building the idea. I was at a meeting for the planning of 2035 for the county. And I can't go into all the details, but I asked the question, where is health in that plan? Because a lot of it's around zoning and things like that. And the answer was, it's actually, for the first time, they've put in a big section on health. So people are starting to think that way about how health, for me, the climate change, for example, and our effect and what we're doing is all about health, right? It's about health. It's about health, right? If the as the climate changes, it's going to make things potentially harder for people to live a healthier lifestyle, or it's going to bring in increased vector-borne illnesses, et cetera, et cetera. So that's where we come in and to try to infuse some of those concepts and ideas, and then you can come in with the more formal presentation, as well as we can link that to the person that we hire to champion this. I don't know if I answered that question. Did I answer your question, Christine?
Yes, I think so. I see, and thank you so much. And I see a number of hands. I believe Sharon, I think yours may have been the first that I saw.
Yes. I just wanted to remind folks that a number of years ago, I want to say it was it was pre-COVID, 2017 or 2018. We did
18.
was it 2018? We did two trainings that the target population was Prince George's County agency heads and program directors. They were very well attended, and they were on health equity, which was like a basic, what is health equity? That was done by a very dynamic speaker. And then we had breakout sessions to talk about health equity in their own programs and health and all policies. And then we had a tool that we handed out and asked people to do to evaluate their agencies and departments related to the implementation of health equity standards within their own agencies. And it was just really, really good. It was, both of them were very well attended, and a high level of participation. And it may be, as the department starts to do its strategic planning process, that this training might be one of the goals, is that there's a training for everybody in how to implement health and all policy, specifically within agencies and departments.
I mean, I honestly, I think that's going to be a something we will do. I mean, it's not an if. I think we have to train people and give them an orientation of what this means, because it's a mind shift, it's a paradigm shift, and it's going to take a lot of time, because we think about health, we think about health equity, but not everybody thinks about health and health equity. They think about their own silo. It's, to me, it's not a matter of if we do this, it's really a matter of when and the timing of it. Anya, do you want to add anything?
Sure. Good afternoon, everybody. I would say that when discussing goals and priorities for the Board of Health for this year, both the chair and the vice chair are deeply committed to health and all policies. This is definitely something that they want to revisit, like implementing RAND report recommendations, since a lot of energy, financial resources have been invested into that report. We are yet to see any, concrete implementation of what those recommendations have been. As you have mentioned, Ms. Galeros, she did championship this cause, and thanks to her, the resolution 127 was passed in 2020. Once again, this is something that still needs to be revisited. There is an interest from the Board of Health to revisit it, and we're actively working with Dr. Levy and his staff to determine what is the best timeline. But I would say that on our end, this is actually one of the top priorities that we would like to actually investigate and dig deeper this year. I do understand that, overall implementation will take time and will require obviously participation from numerous actors. But on our end, we would like to at least what I call resurrect those conversations. So that's where we stand with regards to the Board of Health on this matter. And thank you everybody for your wonderful work. I always tell you that I view you as such a wealth of knowledge. So it's always a pleasure. So thank you for checking in.
Yes, and thank you, Anya. I love the fact that you've known what some of our goals and thoughts are, and you're working with the Board of Health directly. So I for one am excited to see that connection, as I'm sure several others, because I know you've thought deeply about a lot of the implementation needs and gaps, frankly, and how to coach our board. Were there other questions for Dr. Levy? And it does sound, based on what you're saying, Dr. Levy, I know you referenced some other counties around the region. Are you also thinking, so like Fairfax has a chief equity officer, and like a one Fairfax plan that kind of speaks to equity across the entire organization, the entire county. Is that something that you may support, or are you still kind of forming what the correct direction is for Prince George's County?
So that type of policy would be above. It would be at the county executive level, and it would have to be. We can make the recommendation. We can create the kind of platform and the ideas behind it, but it would really come from the county executive's level. I as a health officer, health is that's what we do, right? And our goal is to have all residents healthy. So, but I also have to I have to convince, the rest of the organization, so to speak, that this is what we need, how we need to focus our energy. And I should say that the county executive this year has made health a priority. So as far as getting funding and going towards the state and trying to ask for more resources for the county and creating the Huron report to highlight the inequity between our county and other counties. I mean, these are all things that the county executive has supported, because they know that we all just came out of a terrible pandemic, and if you don't realize, if we haven't learned anything, then we're doomed to repeat it. So we have to put more energy and time into our public health infrastructure, and that includes a larger approach to health, and it's not just us, it's Homeland Security, public safety, and Parks and Rec, and those are all contribute to the health of the community. So I think the county is headed in a positive direction. There are going to be as far as a broader campaign, though, I don't think we're quite there. But I certainly on the radar.
Yeah. And I see Dr.
Yeah, so thank you
Thomas's.
again.
Yeah. Can you hear me okay?
Yeah, Dr. Tom. You can.
Dr. Levy? Wow. Where have you been, my friend? I'm just so happy that you're here. And I want you to know you have an army of wellness warriors that were tested during the pandemic. And who would have imagined it would be the Black barbers and beauty salon operators, where we did the very first COVID vaccines anywhere in the country in a barbershop, right here in Prince George's County. So here's what I would say to all of you. We need to step it up. Prince George has led the way in the state. Prince George has closed the racial disparity gap in vaccinations. How did we do that? And when we answer that question, Dr. Levy, we'll know what to invest in more. Because right now, just from my perspective and to the network of barbers and stylists across Prince George's County, it feels like some of our community collaborators have gone back to their silos. That's just the reality. It's not a criticism, it's an observation. When we make that phone call, they want to come out to the community. But they don't have the manpower. The grants are over. And so that's the dilemma. So we've trained our barbers and stylists to become certified community health workers. They've gone through training by the CDC to become certified lifestyle coaches. They are now using the Maryland HALT platform for diabetes coaching. And all this is happening in Maryland and in Prince George's. And all I'm saying is that somehow we don't break through the noise. We've got to break through the noise here in Prince George's, that we have the lesson for Baltimore City. We even have the lessons for the District of Columbia. But somehow we kind of get lost in that mix. So that's my observation. And my team was involved in implementing the Health and All Policy Work Group that led to the law. So we are ready, waiting for the general to show up. Thank you, Dr. Levy.
I don't know. I don't know if a general is the correct. More of a collaborator, I think. But thank you for saying that.
I'll just say that this space that was created, I've always called the solution space. This was the space where we came during the pandemic and literally solved problems in real time. And the reason I say general is because during the pandemic, the metaphor that led the way was a military kind of metaphor. Heat maps and sending out the National Guard. And if that's the language we're going to use, then we need a general. And right now, you're our general, brother. And I can't wait to take you into the shops. They want to see their leader.
Well, I'm happy to go. I'm happy to go. I'll tell you a funny story. I spent a lot of time in DC, and there was a black barbershop on the corner of where I live. So I went there to get my hair cut. And until one day I went in, and the barber, I was the last appointment of the day, and the barber came in, and he was cutting my hair, and then he got a call from his wife, and he was apparently like late for dinner or something. And I left the shop with a haircut that was sort of like this. So I'm like, that didn't work for me. I got home, my wife was like, your head's sloped.
Well,
I see.
that is so funny. When I went in, I had an afro with a little bald spot in the middle. And I said, can you fix that? He said, well, I can spray paint it or I can even it out. And guess what he did? He evened it out.
Oh my gosh! Thank you, Dr. Thomas. We're community health worker fans. Many of us, myself, even in my organization. I see Sharon's been patiently waiting with her hand raised as well. I wanted to give everybody a chance to talk.
I always have my hand raised. The question I had was, I wanted to go back a little bit to the Health and All Policies bill that had passed also a couple years ago, because it's from the outside looking in, it's really frustrating that we would do all that work to get a bill passed. I worked with Councilmember Glaros' staff on that bill, and it has some very practical actions that it dictates that should be taken. Everything from a training for the Board of Health on basic health equity and health and all policies, to implementing things like requiring contractors to submit along with their proposals health equity goals, and when they report, to report on whether they've achieved those goals. So but none of it has been implemented. Now, I don't think one piece of that legislation has been implemented. So, working with the Board of the Health, which is the county council, really, how do you help them? And is it the health department's role to support them in being able to take action on these things, or to at least hold them accountable for implementing legislation that they passed? I mean, people can talk a good game, but if they don't take the action on it, there's no, there's no accountability there, at least from what I've seen.
I mean, you raise a good point, and it's sort of an unfunded mandate, right? You pass legislation, then you don't put stuff behind it. And this also was passed. The good news is the legislation hasn't gone away. This is also, it also was passed, I think, during the pandemic. So there was a lot of, it wasn't a priority at that moment. And what I'm suggesting is that it's still a priority. It's a question of the timing of it, because when we do it, we want to make sure we succeed. And I want to make sure we are deliberate about what we need in order to move this forward. It's not a matter, and as I said earlier, it's not a matter of if, it's a matter of when. Dr. Areola has done this before. He's well on board with it as well. But we both agree that it's going to take resources to do it, and a real commitment from not just in theory, and not just we want to do this, but to back the legislation. We need someone to move it forward, a champion. That's their whole job, is to move health and all policies forward, because they're going to have to make connections with all the other groups as well as the community, and really try to drive this forward. It takes, from my understanding with Fairfax, it's taken years to do this, and same with St. Mary's, so it's going to take us time, but we need to make sure we're deliberate about it, and that it's supported by both legislation, which it already is, and person power. And that's where the timing of this matters in this year and next year, and in our strategic planning. If we put it in there, then it becomes part of the, what we put our money towards. If it's in the strategic plan, that becomes the priorities of the health department, and by default, the Board of Health, because we've agreed that these are the things that are in there that need to be moved forward. So the priorities, then that becomes the priority, then it becomes funded, and then we can move forward. So that's my only not hesitation, my only caveat to this is the timing and how we do this in a deliberate fashion. And I don't know what happened 2 years ago, except that we had a pandemic, which wasn't a small thing. Or now I guess it's 4 years ago now. It was 2020. And I know it seems frustrating to you, and I can tell you that it will happen. This will happen. It's just a question of when. Kim?
Hi, Dr. Levy. Thanks again for joining. When I spoke with you recently about this discussion, you mentioned that this group could possibly help with supporting the development of a plan or making recommendations for the implementation to prepare for when we're ready to initiate that implementation. Just wanted to bring that up and see if you had anything to elaborate there. So I'd love to keep us all involved.
Yeah, I think it's going to require community input to make sure that it's it meets the needs of the community, and also it factors in, because you all designed this, we worked on this. So yeah, I mean, it's I think what I would like to do is go back and sort of sit down with this and see when we can start putting down, you have the chassis, but you need the wheels and the engine. And the question is, when do we put the wheels and the engine on this and start to drive it down the road? Hope that's a good analogy.
Any other questions for Dr. Levy? I know the one other thing, and Kim, I'm not sure if this is something that was discussed with Dr. Levy, but I heard you mentioned that one of the challenges is, yes, the Department of Health is on board, but what about all those other, so Office of Planning, Office of Public Safety, so Parks and Planning. One of the things that we've been, we too have been delayed. Similarly because of the pandemic, but in implementing a health equity champions program, where the hope is, so we begin to have people within different departments, within the public, also the lay community members also have a better understanding of the various departments across the county that may impact their health. And that is not just the sole responsibility of the health department. And so, kind of having things coming from different angles. So Dr. Sharon mentioned that previous training that where we train department heads. But also I think we also need widespread understanding of why health. So when somebody in Parks and Planning or the Office of Management and Budget hears about this and they're not at the top, maybe there's another champion within their department that has a better understanding and that can help coach them and understand why health relates, how it relates to the work that they do. Sharon?
Hi, good afternoon. Sharon Gibbs Cooper from the Institute for Governmental Service and Research. Hello, Dr. Levy. Hello, Dr. Thomas, and everybody. Just wanted to go back in alignment with Dr. Levy and Dr. Thomas and what they had said earlier about working in silos. And Christine, what you said is perfect. Everything is interconnected, food insecurity, access to healthcare, behavioral health, and so forth. So it's absolutely critical that we understand that these particular players, stakeholders, community investors, they're all a part of solving this problem. And it's not going to happen unless we engage them in this sort of conversation. And so I just wanted to make sure that point was made. And I totally agree with what's being said. And so it starts, and I think this is part of that strategic plan that we're looking at, not only the health literacy, but also being able to engage other partners as well. Thank you.
And I just want to echo that we even in the health department act in silos. And one of the things that I'm really feel passionate about is working together and collaborating, because if you're doing the same thing I'm doing 2 blocks apart, it's a waste of valuable limited resources, right? We shouldn't be. So if you do it really well, you do it and I'll do something else. I got plenty of things we got to work on. So those silos in the county are things that we're starting to address. And actually the Board of Health can help with those silos as well. But the county executive and the senior leadership, the CAO and DCAOs all have to be committed to this. So that is going to take time, and we have to have a good plan of how we're going to do that, how we're going to bring them on board, because it does start at the leadership, the top they have to buy into it. Otherwise, we're going to be kind of dead in the water.
Yeah, so thank you again, Dr. Levy. I did have a question in the spirit of collaboration that we're talking about. I do remember one of our meetings, we had a presentation from the other two work groups, HEAL and Behavioral Health, to kind of talk about their goals and their priorities, and understanding that the HIAP is, a champion of health equity. Collaborating also and getting feedback from the other two work groups and consolidating that collaboration as well with the other two work groups so that we are cohesive in our messaging, and then just also finding out what other organizations they are also involved with that could that can join in this effort.
I think that's a great idea. I think I'll circle back with Kim, and we can start to figure out how to make that happen. I think it's a great idea. Anyone else?
Thank you so much, Dr. Levy.
My
We
pleasure.
appreciate you being here. We've had lots of questions, so we do appreciate having, just some transparency and understand what's happening and why. And we do understand the global pandemic happened, but it's wonderful to hear that you and Anya together will be working together with the Board of Health we look for and we will ask.
Don't
Yeah.
and don't stop poking me. If you're like, where are we? I mean, give me a little time, but don't stop poking. That's okay, because I sometimes daily life gets in the way of moving forward. Sometimes, so I'm okay with that, and I tell our whole team here that if you need something, just reach out. So
Wonderful. And that's recorded, I think, right, Kim? So don't stop poking. We got it.
Well, you mean you should go through Kim first?
Yes, absolutely, absolutely. But we've got it. And if not me, I know there are others around in this virtual room that will continue to champion that. So thank you so much.
Thank you. And thank you for inviting me. And thank you for volunteering to do all this. I know this is a lot of work, and you all have day jobs. So this is my day job, but you all have other day jobs, and I appreciate your time and commitment to this. So thank you.
Yes.
I'm
Thank
gonna
you.
jump off. I'm gonna
Thank you.
jump off then. And you all have a good afternoon.
Thank you very much.
So much.
Okay. Bye-bye.
All right. And so, Kim, did you want to introduce our next presenter?
Absolutely. And I believe she's still on. So are you still on?
Yes.
Excellent. Can I invite you up to share a couple of words about the study that the University of Maryland Gemstone Honors Program is doing? Right now I have the next two slides are your slides that you shared. Is that okay if I keep those, or did you have anything else that you wanted to put up?
Oh no, this is perfect. Thank you.
All right, the floor is yours.
All right. Hello. Good afternoon, everyone. My name is Esohe Awi. I'm a current junior at the University of Maryland College Park, studying public health science as my major and French studies as my minor. And next semester, I will be a master's student in health equity. So that's very exciting for me. But here I'm on behalf of Team Black Women's Matter. We are a junior Gemstone Honors Program team. So Gemstone is a 4-year multidisciplinary research program. We're in our 3rd year, and we're in the process of survey dissemination. So a little bit about our research. We are investigating factors that influence health outcomes in Prince George's County, particularly about Black maternal health. And we have 2 populations that we are in the process of studying. First would be providers. So we're looking very closely at patient-provider interactions, and we want to understand how healthcare curriculum in medical school, how does patient-provider interactions influence health outcomes for Black mothers? And then we're also going to be speaking with Black mothers residing in Prince George's County to get more perspectives on their birthing experience and how that has been with their pregnancy. So we are currently IB approved. So we've created a survey, we've gotten IB approval, and we're in the process of survey dissemination, which is why I'm here humbly asking for your support in helping us disseminate our survey. We've been coming to the Health Action Coalition meetings since our first year on and off based on the recommendation of our mentor, Dr. Latush Howard. And now that we're in the process of survey dissemination, we would like your help in helping increase the reach of our survey and get as many people residing in Prince George's County to fill it out. So we've already sent out a toolkit to Kim and Taylor, but that is something that we can also send out again. But I think they'll be handling that for the most part. We have in that toolkit, we have material for like Instagram posts, but also emails, but PowerPoint slides like these, if you would like to put that in your offices or just send them to people that you know. But yes, that is my humble request. I can take any questions at this time. Oh, if anyone has any questions, I can answer them. Sorry.
And the provider, for clarification, the provider survey, that is solely physicians. So are you interested in nurse practitioners, midwives, or is it solely physicians who are obstetricians, OBGYNs?
Yes, so for the purpose of our survey, we're looking only at current medical students or licensed OBGYNs with clinical experience.
Thank
Sharon, did you have a hand raised?
No, she asked my question. I was wondering whether there was a provider type that you were particularly interested in. And I would just make a recommendation that you make a little adjustment to your beautiful brochure here to stipulate what provider types you're looking for.
Okay, thank you.
And even I'm seeing it now that you did have medical students under, are you eligible? Medical students and licensed OBGYNs. Okay.
Is there a specific year in medical school that you would tailor that the survey is for? Because depending upon the year, whether they have the clinical exposure or whether it's just didactics.
No, there is no year
okay.
restriction for medical students because we're looking at the curriculum, and that would start from their first year in medical school up to when they actually get residency or practice.
Okay, perfect. Thank you.
All right. Well, thank you, Sohei. Best of luck with the study. I'm certainly interested in learning how things end up and what you learn. And we will, I mean, at least I will certainly pass it around to anybody that may fit your criteria for either providers or pregnant women.
Thank you for the support. I appreciate it.
Yeah, and thank you for joining and supporting us.
Of course.
All right, so I see that we already have support for you since Rachel is sending to their OBGYN partner. So it'll start rolling. Thank you so much. And Mr. Sacer, I'm not sure if you're in a position I can walk through the next slide. But just as some updates, thank you to those who met in between meetings. A large group of us got together and looked at the Health Equity Champions objectives. If you were on last time, I think that we did some work, and we continued to do some massaging of the objectives to really hone in on the core concepts that were needed. I know some of the based on feedback, I think we were able to ensure that content addresses objectives, or at least, well, that's actually one of the next steps. But we wanted to establish objectives that that helps the end user, the champion, be able to champion the cause of health equity and health and all policies within Prince George's County. So we had that in mind. So some of the next steps that I know need to happen. Thank you. I can't remember who recommended, but we know we were just throwing out words, and they are not in a proper, especially those of you who come from academic backgrounds, they are not in true objective format. So we are going to use Bloom's taxonomy to ensure that the objectives are measurable, specific and measurable, and they start with an action verb from Bloom's taxonomy. Next, I know we also want to make sure, now that we have a better sense of the objectives, I should have done this the other way around, but hindsight's 2020. Look at the content to make sure that the content that now exists, does it address the objectives that were reworked? And then develop a logic model and explore funding opportunities. This is not something I think that's one of the things that has not really been addressed consistently. It's okay, you can't answer the how is this going to be implemented without really knowing what's funding it, what mechanisms are supporting it. So that's those are some of the next steps. So Sacer, did you want to add anything? I know she had to step away. So Cameron Taylor, did I miss anything based on some of our other previous discussions?
I'm not sure. Would you like us to take the opportunity to kind of expand on the funding discussion and open that up?
Sure. I think this is a good opportunity since we were up. We actually do have the time. I was rushing because for some reason I thought we were at the end. Well, so I think one of the questions that we've often had is, what is the structure? How is this going to be facilitated? Those are hard questions without having money. While often can we have volunteers? Sure. Is that a sustainable system and process? Likely not. So usually even minor things may require some funding, even if we develop a curriculum and it's online, just all that stuff, even if we have volunteer facilitators, we still will need some sort of seed funding to develop an infrastructure to support the implementation. So we have not had larger discussions about the funding, but I think this is time because often sometimes it's the carrot before the horse, or the horse before the carrot. You can develop your vision and then go after funding, which I think we have, but there's still some limitations. I think it would be more helpful to know, well, what are we working with so that we can fully flesh out the hows. And I know there are many around the room who've had plenty of experience, may know some potential resources or places that we may go to look for funding. Understand this is completely volunteer driven. All of us are volunteers, so that's always been one of the challenges. Likely, if there was somebody like a dedicated coordinator, things can probably move faster. So I think honestly, based on, I've been around and not necessarily in my role, but I remember when this discussion first started, and it has been a while. Sharon's been around. It's gone through several hands. And we've kicked around the idea of funding, and it seems like that's where that we probably need to put pen to paper and maybe at least start to identify where those funding opportunities may come from, and start to explore, because we're getting to a point, we have the concept, we have a lot of meat. You just need to meat on the bones of what the Health Equity Champions program is. But I think next steps, likely to be funding, but I'm open and to hearing other alternate ways of viewing, approaching next steps with, getting this program to actually be implemented. And I know there's several around the room who've been here for a while and may have thoughts. Any suggestions for next steps, or suggestions, or even places to go, or maybe alternate ways of thinking about, approaching the implementation portion of this program?
I would suggest that we look at two things. One is funding, but not just funding. Let's look at what resources might be available to us, because there may be organizations that would be willing to, build this into somebody's position where they would serve as a coordinator because it's something that they do. Or, I think it's more than just cold hard cash that we need to explore. So that's one thing. And then the other thing is, I think it would be a good idea to prioritize what our needs are, because we don't want to just chase dollars. We want to ensure that we get the dollars to apply them to what we really need. If we need a coordinator, then that's number one priority. If we need funding to support technology or, infrastructure kinds of things, then, that's priority number two. But let us define what we need really specifically, so that then we can seek the sources of funding or other resources appropriately.
Myself on mute. Yeah, I appreciate that approach, Sharon. I think, yes, there are other ways. You don't always have to find cold hard cash. And I like the way you're thinking, just the flexible thinking. Maybe there is an organization where, this would just fit into their overall strategic goals. Other thoughts? And actually, just to continue on that, sorry, before I invite others, I know one of the benefits and challenges with health equity sometimes, I know sometimes with the behavioral health work group and Hill work group, they had concrete, many times some of the work was implemented because exactly what you said, this is something that the organization was going to do anyway. Health equity, we found, was a little bit more challenging, because it's something that everybody does or should be doing, but a little less specific, but I hear what you're saying, and I welcome everybody's input, and even just being flexible and thinking about that. You may come across an organization where that would make sense, and we can approach them potentially to think about ways that they could help support the implementation in a way that doesn't necessarily cost money from our end. Other thoughts?
One of the things I was thinking is to think a little bit more about the outcomes. So as opposed to thinking about the substance, self-equity, to think about what are we looking for? We're looking to create advocates. So is there an organization that does advocacy training that might like to adopt a curriculum related to health equity? And I, unfortunately, I don't know the answer, but I think that those kinds of organizations are out there, you know, civic engagement organizations, things like that, that may appreciate this an opportunity to partner.
Yeah, and I think that's one of the, I mean, you mentioned outcomes, and that's kind of when I think of a logic model, that was one of the reasons why I'm like, you kind of need to know, and if you're going to apply for funding as anyway, you need to be able to clearly state what the outcomes are. So, I mean, this is really a progression, really. So I think the talk about the funding opportunities is necessary. I mean, just to put it in everybody's minds, because there may be something that appears that has a once a quarter cycle, once a once every 4 years cycle, so whatever it is, and just to think about it and to get that on our radar so we can keep our eyes open. Not necessarily that we're going to automatically jump at funding, but I do like the way that you're thinking. I think the logic model will help be able to flesh that out, and we can then back our way into what are the components that we need, and then be able to prioritize. Yeah, because certainly outcomes are, we want to know what our outcomes are, to align our funding and potentially ways to, oh, I lost my train of thought. But I see Kim, you raised your hand to save me because I thought it's the end of the day. Sorry.
So one piece, we had a little conversation about this, and I just wanted to make sure it was clear to everyone that although the Healthcare Action Coalition is housed in the health department, any funding opportunities, should we determine that that's the best way to go, don't need to be owned by the health department. So this is a community-run coalition. The health department is just here to help facilitate and bring everyone together. So these strategies can be owned by community partners. So just to keep that in mind, if it seems like, if you come across something that feels interesting to your organization, or you hear another organization speaking to something like this, bring them to the table. Let's join that discussion and see how we can collaborate to build the idea. Because again, it doesn't have to be developed at the health department, at our pace, at our ownership. We are just here to help facilitate the conversation. So just wanted to make sure that that was clear. And we do have other, some of our other work groups. Our Food as Medicine group has been an example of that. They've been seeking funding opportunities through their organizations to complete the work.
Thank you. So I know we had a lot from Dr. Levy today. That was really the focus of our meeting. We thought it was important to hear where things were and where things stand, with the Board of Health. But since we weren't going to have a substantive discussion about the Health Equity Champions program, I think we are at the end and open for community announcements. Does anybody have any announcements that were not already shared with Kim? And I can selfishly share a community health work, a webinar that my organization's Community Health Worker Academy is hosting on Wednesday, for those who are interested in leveraging apprenticeship programs to start or supplement their community health worker programs. It's open to all, it's free. We invite you or any others who may be potential CHW community health worker employers to join.
can you send that flyer out, the community health worker flyer, so that I can share it amongst my good partners?
Sure, Sharon. Thank you. Absolutely.
Yeah, we'll be sure to include them all with the notes and the recording. We have a couple of other community announcements that were sent in advance from it. I don't think the partners are on board, but this one is from the Capital Area Food Bank, and it is about feeding kids in your community. And they are looking for organizations who want to host an after-school or summer meals program. They have a couple of requirements. You have to serve at least 10 children daily, ages 5 to 18 in your after school or summer program. And we'll be able to send this flyer out to anyone that might be interested. This group will also be presenting on this program at an upcoming HEAL meeting, the Healthy Eating Active Living Work Group meeting on April 3rd, if you or someone you know wants to hear more information. Next is from the Maryland Department of Health. They are calling on pediatricians and family physicians to join the Maryland Department of Health in the fight against HPV-associated cancer. So they're specifically aimed at increasing their first dose HPV vaccine rates for eligible patients ages 9 to 21 by 25%. So they noticed that only about half of girls and fewer boys receive the HPV vaccine compared to 90% of teens who are receiving their MCV4 and Tdap vaccines. So, and to increase those vaccine rates, they're really going to be encouraging providers to provide all vaccines in the same way and on the same day. So I will send information to promote this effort. And of course, if you have follow-up questions, we have some points of contact for registration in the flyer. And now we have a plug from the health department team. They are looking for a public information officer. So the minimum qualifications is a bachelor's degree in journalism, communications, or public relations or a related field, plus 3 years professional experience in journalism, public relations, or a related field. So this is a higher level information and media relations role. So we encourage anyone that's interested to apply or share with your students. And then I can leave to our chairs to close us out and share our next meeting.
Thank you all for attending. I know myself, I got a lot out of learning what's happening from Dr. Levy and Anya with the board. And thank you so much. Our next meeting is on April 18th. I don't know if that was, is there Sacer coming off mute? And if you wanted to share anything before we left.
Yeah, sorry. Yeah, that was me coming off mute a little bit. We had such a great discussion. So glad that Dr. Levy was able to join us to give us a broader look about the structure. And Anya, thank you again for your wealth of information. And we definitely look forward to working with you more as we're collaborating with the Board of Health. And thank you for everyone for joining today. And we definitely look forward to keeping in touch and seeing you at our next meeting.
Thank you all.
Thank you.
Thanks, everyone.